Hello everyone and welcome to Dr. Mohonomics. In today's video, we will be discussing the side effect of metoprolol, a commonly prescribed medication used to manage high blood pressure, heart disease and other cardiovascular conditions. I will break it down in a simple, easy to understand way so you know how to expect if you are taking or about to start this medication. So, what exactly is metoprolol? Metoprolol belongs to the class of drugs called beta blockers. It works by slowing down your heart rate and reducing the force with which your heart pumps blood. This helps to lower blood pressure and manage heart failure and reduce the risk of future heart attacks in people with the cardiovascular diseases. While metoprolol is effective for many conditions, like all medications, it comes with the potential side effects. Most of the time, side effects are mild and go away on their own, but some can be more serious and may need medical attention. So let's start by looking at the common side effects of metoprolol. These are the side effects that many people experience but are usually not severe. Let's look at the first side effect of the metoprolol: tiredness or fatigue. Many people who take metoprolol feel more tired than usual. This happens because metoprolol slows down your heart, which can make you feel like you have less energy. Usually, this feeling goes away after your body adjusts to the medication, but if it doesn't, speak to your doctor. Dizziness or lightheadedness. Because metoprolol lowers your blood pressure, it can sometimes make you feel dizzy, especially when you stand up quickly. To prevent this, try getting up slowly from a sitting or lying position. If you feel faint or a dizziness is extreme, let your doctor know. Slow heart rate, or we can say a bradycardia. Metoprolol is designed to slow down your heart, but sometimes it can slow it down too much. If you notice your heart rate is constantly below 60 beats per minute and you feel weak or lightheaded, contact your doctor. Cold hands and feet. Since metoprolol reduces blood flow to your extremities, you may notice that your hand and feet feel colder than usual. This side effect is usually not dangerous, but if it bothers you, it's worth mentioning to your healthcare provider. Digestive issues. Some people experience mild stomach upset, nausea, or even diarrhea. When they start taking metoprolol, these symptoms are usually temporary. If they persist or become severe, check with your doctor. Shortness of breath. Metoprolol can cause mild shortness of breath in some individuals, especially during exercise. If you experience difficulty breathing, even at rest, it could indicate a more serious problems and you could seek medical attention right away. Now let's move on the less common but more serious side effects. These are the ones you should be particularly aware of and report to your doctor if they occur. Number 1, depression or mood changes. While rare, some people taking metoprolol have reported feeling depressed or noticing changes in their mood. If you start feeling unusually down, anxious or irritable, don't hesitate to talk to your doctor. Worsening of heart failure symptoms. Though metoprolol is often used to treat heart failure, it can occasionally worsen heart failure symptoms in some people. If you notice increasing swelling in your legs, more pronounced shortness of breath, or rapid weight gain, this could be a sign that your heart failure is getting worse and you could seek medical help right away. Severe allergic reactions. Although very rare, some people can have allergic reaction to metoprolol. Symptoms may include rash, itching, swelling, especially of a face, tongue and throat, severe dizziness or trouble breathing. If you experience any of these symptoms, it's important to get emergency medical care immediately. Worsening of asthma or breathing problems. If you have asthma or other respiratory issues, metoprolol can sometimes make your breathing worse. Beta blockers like metoprolol can cause the airway to tighten, which could lead to wheezing or shortness of breath. If you have history of breathing problems, your doctor may prescribe a different medication. Low blood pressure or hypotension. Metoprolol is used to lower blood pressure, but in some cases it can lower it too much. If you feel extremely dizzy, faint or weak and your blood pressure is consistently low, talk to your doctor. Unusual tiredness or weakness. If you feel unusually weak, especially when combined with other symptoms like dizziness, fainting or slow heart rate, it could be a sign that the dosage of metoprolol is too high and your doctor may need to adjust it. So now let's talk about the long-term side effects. For most people, metoprolol is safe to take for a long time, but in rare cases, prolonged use may lead to weight gain. Some people report gaining weight while taking metoprolol. This could be due to the fluid retention or a slower metabolism, as the medication reduces your heart rate or overall energy level. Sexual dysfunction. Beta blockers like metoprolol can sometimes cause problems with your sexual function, including erectile dysfunction in men or decreased libido in both men and women. If you notice any changes in your sexual health, it's important to discuss with your doctor, as they may suggest a different medication or treatment plan. Hair thinning. Though rare, some people have experienced thinning hair as a side effect of a long-term metoprolol use. If this happens, it's usually mild, but it can be distressing. Let your doctor know if you notice this side effect. Now, the question is, do metoprolol interact with other medication? So, answer is yes. Metoprolol can interact with a number of other medication, such as combining multiple beta blockers can dangerously slow the heart rate. Blood pressure medications. Medications like calcium channel blockers, for example, verapamil, may enhance the effect of metoprolol and cause dangerously low blood pressure or heart rate. Antidepressant. Certain antidepressants such as fluoxetine or paroxetine can affect how your body processes metoprolol. Non-steroidal anti-inflammatory drugs. This can reduce the effectiveness of the metoprolol in controlling blood pressure. Cold and flu medication. Some over-the-counter decongestants can raise blood pressure, counteracting metoprolol's effects. It's crucial to know when to get medical help right away. You should seek immediate medical attention if you experience severe dizziness or fainting, shortness of breath that getting worse, a slow, irregular or rapid heartbeat, swelling of the face, throat and tongue which could indicate allergic reaction, confusion, hallucination or a severe depression. These are the side effects that require urgent care. Before we wrap up, let's quickly touch a few precautions. Tell your doctor about your medical history. If you have asthma or other breathing problems, metoprolols can cause the airway to constrict. If you have asthma, chronic obstructive pulmonary diseases or other respiratory conditions, let your doctor know. They may prescribe an alternative or adjust your dose. Heart condition. If you have slow heartbeat, or we can say a bradycardia, certain heart blocks condition or severe heart failure, metoprolol may not be safe for you. If you have a low blood pressure, hypertension, since metoprolol lowered blood pressure, it may not be suitable if your blood pressure is already low. Diabetes. Metoprolol can mask symptoms of low blood pressure, hypoglycemia, such as rapid heartbeat. If you have diabetes, your blood sugar levels need to be monitored closely. Liver problem. Since metoprolol is processed by the liver, those with liver condition should take caution, as it could affect how the drug is metabolized. Avoid alcohol. Drinking alcohol can enhance the blood pressure lowering effect of metoprolol, which may increase your risk of dizziness or fainting. It's best to limit or avoid alcohol while taking this medication. Be cautious when driving or operating machinery. Metoprolol can cause drowsiness, dizziness, or a blurred vision, especially when you first start taking them. Be cautious when driving or operating heavy machinery until you know how the drug affects you. So, in summary, metoprolol is an effective medication for controlling blood pressure and preventing heart-related issues. But like any other medication, it can come with side effects. Most side effects are mild, manageable, but if you experience anything unusual or severe, make sure to reach out to your doctor. Remember, never stop taking metoprolol suddenly without consulting your healthcare provider, as this can cause a sudden spike in blood pressure or even a heart attack. If you have any more questions about metoprolol or its side effects, feel free to drop in the comments below and I'll do my best to answer them. Thanks for watching, and don't forget to like, share and subscribe to Dr. Mohonomics for more easy to understand health information. Thank you.